Hello, Edward.
Hi.
I understand you lost your prescription refill paperwork.
Yeah, it'll probably turn up at some point. It's hard to keep track of all this paperwork.
How have you been taking the medication?
You know, like we talked about, maybe once in a while, on bad days, I take an extra dose.
You requested refills several times over the past few months before our scheduled appointments. I'm concerned about the increase in the amount of medication you're taking.
I just lost my prescription, that's all. It's not a big deal. Just have a lot on my mind. It will turn up.
Things like losing refills or paperwork or taking more than the prescribed dosage can be a signal of other problems. It's my responsibility to address them, to ensure that you're using the medication safely and effectively and that its benefits outweigh the risks. I understand you're in a lot of pain and that you're asking for medication to relieve that pain. But if the medication isn't working anymore, or if you're becoming addicted to it, we want to find this out sooner rather than later so we can do something about it. We're working on this together.
The reason I need more medication is because it's not working as well as it used to.
You've been taking opioids for about 7 months, and you have been recently requesting additional medication, but there hasn't been any improvement in the pain. What this indicates to me is that the drug is no longer as effective as it once was. What I'd like to do is ask you some questions that will help me determine the best course of action at this time. Please answer them as honestly as possible.
You're not going to give me any more medication unless I answer these questions, are you?
No, I'm not comfortable renewing your prescription until I know a bit more about how you're using the medication and how it's affecting you. There are 16 questions here that need to be answered. The 5 answer categories are never, seldom, sometimes, often, and very often. Anger issues, avoiding tasks at home, using pain medication for symptoms other than pain relief, concern from family members. These are all indicators of a problem with medication abuse. On top of that, you say they're also not improving your pain. So we need to find alternatives to opioids.
Can't I just get a prescription for 1 more month? I'll stick to the agreement. I need these meds at least for a while longer.
I understand your concern, but at this point, the risks of continuing an opioid medication are outweighing the benefits. I know you're in pain, and I'm going to work with you to provide as much relief as possible, but it's important that we find an alternative. Our goal is the same as before, to manage your pain and return you to full function. That hasn't changed. We're going to work on this together.
Well, what kind of alternatives are we talking about here?
Non-steroidal anti-inflammatory drugs can be effective, and the work you've been doing in physical therapy is helping too.
Okay, fine, but what do I do right now? If I don't take the pills, I start to feel really bad.
We're going to work with one of my colleagues, a pain specialist. He'll recommend a strategy to lower your dose of the opioids safely to avoid withdrawal while still managing your pain. You might be having cravings for the opioids that have no relation to your pain. So we will also work with a colleague of mine that can prescribe a medication to treat your addiction to the prescription opioids. That medication may also help with your pain. We will do this as a team.
You sure we can't try it for another month? I know I made some mistakes and didn't always follow the agreement, but I can do better. Just give me another chance.
Edward, as your doctor, it is my best medical judgment that it's reached the point where it's causing more harm than good. Taking you off the opioids isn't some kind of punishment. You haven't done anything wrong. They're just not a long-term solution, so we need to transition to another treatment plan. I want to reiterate that I'm here to help you with this, to work with you. I know you're in a lot of pain, and we're going to work as a team to do everything we can to alleviate your pain and improve your functional ability. Do you understand why we need to do this?
Yeah, I do. Of course. I'm not blind to what's going on. I'm just scared, that's all. It's been a really difficult time for me.
I completely understand. Many of my patients have experienced the same issues you're experiencing, and we've worked together to get through it.